during COVID, we actually began to provide follow-ups for our pregnant moms who did have COVID when they left the hospitals. But we expanded that into our moms who have some adverse maternal events, so that we provide follow-up for them when they go home and ensure that they're taking their medicines, ensuring that they're seeing their docs for appropriate follow-up. We know that's the right path, part of it, so that's going to be expanded.
Hello, I'm Rob Hoyle. Thank you for tuning in to 20-Minute Health Talk, where some of the brightest minds in healthcare help us break down the latest news and development. I'm joined by my co-host, as always, Chris Guzewski, and today our special guest is Dr. Michael Nimaroff. Dr. Nimaroff is a Senior Vice President of OB-GYN at Northwell Health and Chair of OB-GYN at North Shore University Hospital and LIJ Medical Center. Dr. Nimaroff, thanks for joining us.
Thanks for having me.
Welcome. There's a crisis happening in healthcare, and every time we hear about that, we think automatically of COVID, but there's another one that's happening, and that has to do with women giving birth.
Yeah, so, clearly, prior to COVID epidemic, we've in OB-GYN field, we've certainly known and been focusing on this growing crisis of increasing maternal morbidity and mortality in the United States. Our black moms see in the United States up to 4 to 5 times the maternal death rate that non-black moms have, and why, with our incredible healthcare system, technology, and incredible teams, why do we have this problem compared to some of, let's say, our other our European countries? So this has really been identified as a major focus, and this was highlighted again with the COVID epidemic. So this is an issue that we need to really focus on, and we need to find the solutions. And us, in our division, our department at Northwell, we are really committed to sort of finding and understanding this problem and attacking this crisis.
Any insight to why this is happening?
So, again, just certainly, our healthcare system in the United States, are under insured populations don't come to the hospital early. They don't see the doctor regularly, and they have issues with access to care, and that's one problem that, of course, that goes throughout our healthcare system, right? So clearly, we need to improve access to care, but it goes beyond that. Certainly among our moms of color, the issue really goes beyond just access, and it's also related to issues with unfortunately, with racism that still exists, bias that still exists, and certainly one approach to dealing with this problem is really getting our teams to understand the issues really revolve around inherent bias that we all have. And so this is one of our approaches, is certainly training our teams and having everyone on the team take part in bias training to understand our own inherent biases.
Yeah, so there's a statistic. American women today are 50% more likely to die in childbirth than their mothers were.
Yeah.
Is that really just indicative of the times? Like, how have we gone from then to now?
Yeah.
And
So again, as we started to talk about what are the causes, right? There are a number of causes, not just obviously our issues with insurance and access. That's part of it. But this goes across the gamut for all our moms, that we certainly see an increasing incidence of maternal morbidity. And when I say morbidity, it's adverse outcomes, whether it's hypertensive issues, bleeding issues, other complications of pregnancy. So what we find is that today, first of all, our moms are a little bit older than they were, let's say, decades previously. So that's one part. And so our moms certainly have significantly higher incidence of comorbidities. So they have other medical conditions, other problems, which complicate their pregnancies. So, we know certainly the incidence of comorbidities. So once again, having, higher incidence of diabetes, a higher incidence of high blood pressure, other medical conditions, absolutely is a factor. What's unique about the Black community in particular is that these disparities in outcomes exist even when we control for all of those factors. So they get close, it improves, but it's not where it should be. So that's really, one major portion, what's felt to be one of the causes. Another problem unique to the United States is also our cesarean section rates. So and our cesarean section rates in the United States also are higher than the rest of the world, although the world is catching up to us. But our rates are high, and certainly we know that moms who have C-sections and subsequent pregnancies are at more risk for some of these complications.
This whole COVID crisis has been so much bad news, and there's some silver linings that always come out of some of the things. And I think one of the silver linings is even though COVID affected people of color so much more, but it helped to shine a light and to raise more awareness. Are you hoping that this will help raise more awareness for women who are pregnant in minority areas?
So again, getting back to the racial disparities, obviously this is an unacceptable problem. We have to really ensure that we find a solution for this. And certainly in the obstetrical space, all right, this has been identified as a major crisis prior to the whole COVID epidemic. Our national organizations, even our, both the obstetrical organizations, but state, the governor's office in New York State understands that this is an unacceptable problem. And actually last year, so prior to COVID, actually organized a group, a task force to study this problem of racial disparities in maternal outcomes. So again, it's been recognized, but certainly, COVID again brought this to the forefront.
You were on that task force, right?
Yeah.
What was some of the work that came out of there?
So it was, a interesting group that was put together, both of, obstetrical experts, but also of, some members of the community to really study and really come about what are some ideas and approaches to sort of studying and looking at this problem. It's really a lot had to do with outreach into the community. And certainly that is, very critical. We're not going to be successful with dealing with this problem without finding a way for us to partner with the community before patients get to the hospital. And so that was really one of the really big focuses of that group. Okay.
And did that in any way influence moms here at Northwell, or is that a side project?
It did. It sort of lit a fire under in me to sort of say, hey, we need to address this maybe even more comprehensively to understand both the causes. What do we think? Studying. Why do we think this is truly happening? What are the problems? Because it's not just one. And so, certainly we know the issues that we have about racism and bias clearly exist and influence care. That's been well studied, and certainly that's part of this problem, but it's not the entire picture. So we wanted to really take and say, let's use the resources of Northwell, our collaboration with multiple different specialties and our community partners to really approach this and tackle this from, again, comprehensive way, leveraging our resources. So this is an initiative that we're very excited about, and we're trying to sort of, develop and let's say redefine prenatal care using what's best practice. So, again, developing what we all consider with the obstetrical experts. What should prenatal care look like? What should care before someone gets pregnant? And what should care look like after an adverse event? Okay, because we know that you have one adverse event, well, it's likely going to happen again in a subsequent pregnancy. And where patients just end up falling through the crack. And it's, again, we need to take sort of ownership of that and help patients and guide them to ensure that they're seeing the follow-up that they need so that we can prevent the event from happening yet again. So it's, we need to hit it from all sides, from all angles, and we're going to measure our outcomes. And so, we really believe that with this comprehensive approach, we're going to find solutions that will be, we hope to be successful in reducing, that disparate care.
So much more proactive than reactive.
Correct.
Okay.
What does some of the training look like for clinicians and staff? What are the things that people need to know?
Yes. So in hospital care, and that's where much of the focus has been, let's just say, up until this point, and the focus being about management of the adverse event. So if someone comes in is sick, we're really good at taking care of those patients, right? We have incredible facilities. The teams are trained. We do simulations with our teams to deal with, let's say, obstetrical hemorrhage, hypertensive emergency, other medical complications. And so our teams have really gotten their experience with dealing with these complicated problems. What this is about is adding the other pieces to it, which let's say aren't part of traditional care, and it's the care when someone leaves. It's the follow-up, providing resources for follow-up, ensuring patients go for follow-up, and again on the flip side, before someone gets pregnant and early in pregnancy, ensuring that they get the appropriate education that they need and the care and again, if they have let's say, for example, if a patient has a hypertension or a cardiac issue, making sure that they see the cardiologist before they get pregnant, or at least early in pregnancy. So it's that comprehensive piece. So we've added to sort of prenatal care our own risk assessments to sort of identify some of these issues, hopefully early in pregnancy.
Any early returns?
So this is, it's a work in progress. Yes, we do. Our entire program is not fully operational at this point. We hope to launch in the beginning of the year, in the new year. We have really focused a lot on what we've gone live with, and it was related to obviously COVID as well, because again, COVID it also affected our obstetrical population. So during COVID, we actually began with our partners in Care Solutions to provide follow-ups for our pregnant moms who did have COVID when they left the hospitals. But we expanded that into our moms who have some adverse maternal events, so that we provide follow-up for them when they go home and ensure that they're taking their medicines, ensuring that they're seeing their docs for appropriate follow-up. So that has started. So yeah, we've been, we're very, pleased with that. We know that's the right path, part of it. So that's going to be expanded.
How do you stay involved in somebody's life and with somebody who's going through pregnancy and who is underinsured or doesn't have insurance? How do you make sure that they're going to, keep up with their part of it?
Obviously, that's the challenge. It's a challenge we're accepting, and I, thanks to the support of Northwell and our leadership here, that understanding that we need to take this on. And it is our responsibility. So we have to use multiple different resources. So partnering with the community health workers, the federally funded clinics where some of these patients often go for care. We'll see what works. And, this is going to be an ongoing program that's going to need to be, tweaked. We have a large group of some very smart people, on this as part of this initiative. And it's open. We're always open to have more volunteers in our program. We keep expanding our different subcommittees who are studying this, and we're really open to. We're looking for innovative ideas, right? And so part of this program is we're using also some technology. So we are developing using chatbots, to do sort of automated reminders. And this way, there's some automated education and technology around tracking symptoms, reminding patients who need to be seen for follow-up. And we hope will, again, hitting it from all sides will, help us really, reduce the incidence of adverse events.
Do you want to move into our knee-jerk reactions?
Most certainly. Yeah, so we do a segment called Knee-Jerk Reactions where we call it the lightning round. We really just want to throw out an idea. It's going to be a word or a phrase, and we want to get your immediate reaction to it. So
I'm really excited about this.
Yeah, it's been very successful in our in 20-minute health talk. So the first phrase is disparities in care.
It's a crisis.
How so?
The disparities in care for anyone in our country, right, shouldn't exist, right? And here we're talking clearly, it's about race. It really is. And that's just, again, one more added piece that just makes it unacceptable. We need to find and sort of meet this challenge and figure out why we have these disparities. Some reasons we know. Some, yes, it's racism. It's years of patients struggling with underinsurance, poor access. We all know these problems, right? But we haven't completely fixed them yet, but we need to address this, and specifically in our case for our moms in our community, we need to do a better job. And so that's a task that we're taking on.
And the next one up we have is, but you kind of talked about this, is our role, the health system's role.
Caregiver. Healthcare workers were responsible to care for our community. It's all members of the community. And so, I know that comes from the top of our organization, that mission, and certainly that's our responsibility. And again, in the obstetrical space, bringing new life into the world is a privilege. But having said that, so when things go poorly, it's devastating for everyone, all members of the team, obviously for the family that has to deal with the problem. And the truth is, we need to get to our patients earlier.
That was going to be the next one, maternal mortality. So we'll skip over that. COVID-19.
Enough.
All said.
That's all I can say. It's been in, for everyone. You don't have to be in healthcare to be had enough of the stresses that it plays on, family. For every aspect of life. For our healthcare teams, it's been it's been a challenge. It's been one of the most interesting experiences, I think, for all of us that we'll hopefully never experience again. And very proud of our teams. Obviously, proud of Northwell's role that we played in this whole pandemic. But one thing if I have a second, I just want to mention, people forget about the fact that, when we were in the midst of this, the peaks, where our hospitals were overrun with really sick COVID patients, the only other service that was in the hospital was the obstetrical service for the most part. We ran at 100% through it, and it was really difficult for our teams. First of all, we had many patients who were affected with COVID, some very severely. Fortunately, most weren't, and it was difficult. And one of the things that I remember, and again, it was really special, but it was arranged to have the entire family was outside of someone's women, outside of our Katz Women's Hospital, seeing the newborn from a distance through the window. It was really a striking, event. And, again, the teams in the nursing teams, really, everyone was very sensitive to the fact that this was, our moms were stressed. It was a struggle for our patients. And so, but they really did try, at every step to see what we could do to at least make it a little bit better, keep that joy going. And so, it include this also went, we for a while were transferring our patients to a different unit to recover outside of the hospital at some of our facilities. And how much the teams celebrated the births. We provided robes, all kinds of flowers. We gave out roses to the moms. We did whatever we could do to sort of make it at least a little more tolerable during this stressful time. And so there were so many limitations on visitation, obviously for all patients in the hospital, but also for our new moms. Fortunately, at Northwell, we always throughout always supported the idea of having that the significant other, that the partner could be in the labor room with the mom. But we did have limitations, post delivery, just were asymptomatic. But this was a really difficult time with limited visitation, stress on the staff, and trying to still sort of keep that sense of normalcy and joy about, again, bringing the new life into this chaotic world that we were, in. And so it was really, I'm, very proud of, our nursing teams, our residents, all our physicians, the support staff, because it's been difficult.
Yeah. We're coming up on the 20-minute mark, and we always like to end our podcast on a positive note. So what gives you hope going forward?
what gives us hope going forward is that, this, as I mentioned, it's a privilege participating in the birth of a child. And again, it's a privilege to help patients through their struggles. Those who are having difficulty getting pregnant, those who have a difficult time during their pregnancy, have issues that we have to deal with. So what gives us hope is that we have some great teams. We have a lot of support, and we keep growing even through all what's going on today in the world. We have a number of brand new projects, new labor and delivery units and postpartum units going on at our new South Shore University Hospital. We have another incredible project going on in Staten Island, building really brand new facilities. So honestly, why shouldn't we be hopeful?
That's great. Well, thank you so much, Dr. Nimaroff, for joining us, and thank you for tuning in to 20-Minute Health Talk. Have a great week and stay safe.
Get more expert insights from some of the leading voices in healthcare today. Subscribe to 20-Minute Health Talk on Podbean, Pandora, Spotify, iTunes, and wherever you get your podcasts.